Rhinitis is a common condition characterized by the inflammation of the nasal passages inside the nose, which can lead to a variety of uncomfortable symptoms. While many people might simply refer to it as a stuffy nose, rhinitis is actually a bit more complex than that. At its core, rhinitis involves inflammation of the mucous membrane that lines the inside of your nose. This membrane is incredibly important. It helps filter the air you breathe, trapping dust, pollen, and other particles before they can reach your lungs. When this membrane becomes inflamed, it can swell up, produce excess mucus, and cause a range of symptoms that we'll discuss in more detail in a minute. Types of rhinitis. Rhinitis can be broadly categorized into allergic and non-allergic types. Allergic rhinitis, often called hay fever, is triggered by an allergic reaction to substances in the air like pollen, dust mites, or pet dander. Allergic rhinitis can be further divided into seasonal and perennial types. Seasonal allergic rhinitis occurs at specific times of the year, usually when certain plants are pollinating. For example, many people experience symptoms in the spring when trees are releasing pollen. Perennial allergic rhinitis, however, can occur year-round and is often triggered by indoor allergens like dust mites or pet dander. Non-allergic rhinitis, on the other hand, isn't caused by allergies but can result from various factors like changes in weather, certain medications, or irritants in the air. Non-allergic rhinitis also has several subtypes. Vasomotor rhinitis is one common form, where the blood vessels in the nose expand, leading to congestion and runny nose. Atrophic rhinitis is a less common type, where the nasal passages become widened and crusted. Occupational rhinitis can occur when someone is exposed to irritants in their workplace, like chemical fumes or dust. Causes of rhinitis. For allergic rhinitis, the root cause is an overreaction of your immune system to certain substances, called allergens, in the environment. When you breathe in an allergen, your body mistakenly identifies it as a threat and releases chemicals like histamine to fight it off. These chemicals are what cause the symptoms of allergic rhinitis. Common allergens that can trigger allergic rhinitis include tree, grass, and weed pollens, mold spores, dust mites, and animal dander. In some cases, food allergies can also contribute to rhinitis symptoms, although this is less common. Non-allergic rhinitis can have a variety of causes. Changes in weather or temperature can trigger symptoms in some people. Strong odors, such as perfumes, cleaning products, or cigarette smoke, can irritate the nasal passages and cause rhinitis. Certain medications, including some blood pressure medications and overuse of nasal decongestant sprays, can lead to rhinitis as a side effect. Hormonal changes can also play a role in non-allergic rhinitis. Some women experience nasal congestion during pregnancy or at certain points in their menstrual cycle. Stress and strong emotions can sometimes trigger rhinitis symptoms as well. In some cases, structural problems in the nose can contribute to rhinitis. A deviated septum, where the wall between your nasal passages is off-center, or nasal polyps, which are soft, painless growths in the nasal passages, can lead to chronic rhinitis symptoms. Symptoms of rhinitis. The symptoms of rhinitis can vary from person to person, but there are some common experiences. One of the most typical symptoms is nasal congestion or stuffiness. This happens when the blood vessels in your nasal passages dilate and the tissues swell up, making it harder to breathe through your nose. A runny nose is another hallmark symptom of rhinitis. Your nose might produce clear, watery discharge, especially with allergic rhinitis. In some cases, particularly with infections, the discharge might be thicker and colored. Sneezing is common, especially with allergic rhinitis. You might find yourself having sneezing fits, particularly when you're exposed to your triggers. Along with sneezing, many people experience itching in their nose, throat, or the roof of their mouth. Your eyes can also be affected by rhinitis. They might become red, itchy, or watery. Some people experience dark circles under their eyes, sometimes called allergic shiners. Rhinitis can affect your sense of smell and taste. The congestion might make it harder for you to smell things, which can in turn affect how you perceive flavors. Some people experience a reduced sense of smell, called hyposmia, or even a complete loss of smell, also called anosmia. The symptoms of rhinitis can have a significant impact on your quality of life. They can interfere with sleep, leading to fatigue and difficulty concentrating during the day. Chronic mouth breathing due to nasal congestion can lead to a dry, sore throat. Some people also experience headaches or facial pain due to the pressure from congestion. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of rhinitis. Diagnosing rhinitis typically starts with a visit to your doctor. They'll ask about your symptoms, when they occur, how long they've been happening, and if anything seems to trigger or relieve them. A physical examination is usually the next step. Your doctor will look inside your nose using a special instrument called a nasal speculum. This allows them to check for signs of inflammation, structural abnormalities, or polyps. They might also check your throat and ears, as these can sometimes be affected by rhinitis as well. If allergic rhinitis is suspected, your doctor might recommend allergy testing. This can be done through skin prick tests or blood tests. In a skin prick test, small amounts of potential allergens are placed on your skin, usually on your forearm or back. The skin is then pricked to allow a tiny amount of the allergen to enter. If you're allergic, you'll develop a small, itchy bump at the site. Blood tests can measure your immune system's response to specific allergens by looking for antibodies in your blood. These tests can be particularly useful if skin tests aren't possible or if you're taking medications that might interfere with skin test results. Treatment for rhinitis. Treatment for rhinitis depends on the type and severity of your symptoms. For allergic rhinitis, one of the first steps is often to try to avoid your triggers. This might involve staying indoors when pollen counts are high, using air filters in your home, or removing carpets that can harbor dust mites. Medications are often used to manage rhinitis symptoms. Antihistamines are a common choice for allergic rhinitis. They work by blocking the effects of histamine, the chemical your body releases during an allergic reaction. Some antihistamines can cause drowsiness, while newer ones are less likely to have this side effect. Nasal corticosteroid sprays are another effective treatment for both allergic and non-allergic rhinitis. These work by reducing inflammation in your nasal passages. They're generally safe for long-term use, but it can take a few days or weeks to see the full benefit. Decongestants can provide short-term relief from nasal congestion. They work by shrinking swollen tissues in your nasal passages. However, they're not recommended for long-term use, as they can lead to rebound congestion when you stop using them. For severe allergic rhinitis, your doctor might recommend immunotherapy. This involves gradually exposing you to increasing amounts of your allergens, either through injections or tablets that dissolve under your tongue. Over time, this can reduce your sensitivity to the allergens and decrease your symptoms. For non-allergic rhinitis caused by structural issues, like a deviated septum, surgery might be recommended. Procedures like septoplasty can help correct the structural problem and improve nasal airflow. If your rhinitis is related to nasal polyps, your doctor might prescribe oral or nasal corticosteroids to shrink the polyps. In some cases, surgery might be needed to remove large or persistent polyps. Home treatments for rhinitis. When it comes to managing rhinitis at home, there are several strategies you can try to alleviate symptoms and improve your comfort. Nasal irrigation is a popular and effective method. Using a neti pot or saline nasal spray can help flush out irritants and excess mucus from your nasal passages. Steam inhalation can also provide relief. Simply leaning over a bowl of hot water with a towel draped over your head can help moisturize your nasal passages and loosen congestion. Applying a warm compress to your face can help ease sinus pressure and pain. For those with allergic rhinitis, keeping your home environment clean is crucial. This includes regularly washing bedding in hot water, using allergen-proof covers on pillows and mattresses, and vacuuming frequently with a HEPA filter vacuum. Keeping indoor humidity levels between 30 to 50% with a dehumidifier can help prevent mold growth, which can exacerbate symptoms. Essential oils like eucalyptus or peppermint, when used in a diffuser, may help open up nasal passages, though it's important to use these cautiously as they can be irritating for some people. Staying hydrated by drinking plenty of water can help thin mucus, making it easier to clear. Lastly, some people find relief by elevating their head while sleeping, which can help promote sinus drainage. While these home remedies can be effective, it's important to consult with a healthcare provider if symptoms persist or worsen. Now, we want to hear from you. Do you or someone you know have rhinitis? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.